This is Kevin Courtney with an NEU report on COVID and schools for Friday the 19th of November. And at the date of this data, which is the 13th of November, cases had fallen quite remarkably. The fall in cases happened before half term, continued through half term, and then carried on for a bit afterwards. We know it's just started ticking up again now. Currently, on this data, 1 in 65 people have the virus. The pattern is the same in England and Wales. There's an increase in Northern Ireland. Scotland still doing a little better on this data. When you look at the ages, this is the ONS survey, so it's not based on people turning up for tests, but a random sample of the population. You can see a very big decline in cases in secondary schools that did start before half term, but has carried on through half term and then a bit after. Cases have started picking up again now, but that decline is notable, and so is the decline in primary schools during the half term period and a bit before. This chart breaks out the ages in a bit more detail, and the green line is from age 10 to age 14. And it's the highest, and you can see the increase. The red line is age 5 to age 9, also going up. What's quite notable is that the yellow line for age 15 to 19 is now a lot lower. That's clearly the effect of vaccination in the 16 and above age group. This rather complicated chart shows the different school year groups and the weekly incidence of COVID. On this chart, every week is a new bar on the chart. And what we can see looking at the data here is that vaccination is having a really significant effect. So for the first time, secondary school cases are now lower than primary school cases. We think that must be partly because of vaccination, even though vaccination has not yet reached anything like the full extent. This chart compares vaccination in England and Scotland, and you can see that in Scotland we are now at a place where 57% of 12 to 15-year-olds are vaccinated. In England we are still only at 37%. It's important that we carry on with that vaccination effort. Now, because cases are higher and have been higher amongst school children than amongst other ages, that has also meant that there has been more chance of catching COVID if you are a worker in those areas. Now, you're double vaccinated, you may not have a serious impact from it, but we know that in the period of the very highest cases, there were 40% more education workers getting COVID than the average in the population as a whole. Currently, it's about 25% more. And the ONS acknowledges that's because cases are higher. Now, one of the things we're saying to the Department for Education is that this increases the chance of an education worker having long COVID. And therefore, we're saying that they should be advocating to schools that they treat it as an industrial disease and therefore do not use the limits of running out of full pay and half pay sick pay. Get in touch with the union if you have an issue around that. But it also means these increased cases in secondary schools and primary schools, even though we've seen the fall over half term, means that we think there still should be mitigations in place and as the vaccination rolls out. And the mitigations we've been arguing for are to keep masks until the vaccination is complete, that there should be isolation of very close contacts of siblings and of siblings of children who have a positive case until they get a negative PCR test, to have more encouragement of the use of lateral flow tests, and to really be looking at ventilation, as well as saying that at the moment we still shouldn't be having in-person huge staff meetings or parents meetings where the virus can spread. Now, the government has made some moves on some of these things this week. So on masks, there is new advice from government to directors of public health that they can introduce masks in communal areas of schools in areas of high prevalence. That's a change from where they were saying that was only in an area of at your school with an outbreak. That's a much wider application. We hope directors of public health take that up. They're also changing what they're saying about the isolation of siblings. Not quite to the Scottish position of those siblings staying at home until they get a negative PCR test, but now saying that a sibling of a child who has COVID should be doing lateral flow tests daily at home during the period at which infection might be possible. Schools will need to work with directors of public health on conveying that message to parents and children of siblings who test positive. The government tells us that a very large number of CO2 monitors have been distributed, 270,000. They tell us that 99% of secondary schools now have CO2 monitors sufficient for one for every 2 classrooms. Let us know if your school doesn't have the CO2 monitors. In primary schools, they're catching up with that, but at a place where they say that 75%, 3/4 of them, have the CO2 monitors. They say all schools will have them before Christmas. Obviously, the point of those CO2 monitors is to use them. Look at the advice on the NEU website about the sorts of levels that you should be expecting of CO2 in your classroom, and then taking action if the CO2 levels are too high, talking with your head about actions that can be taken to improve ventilation in those rooms. We've also been saying that there should be better use of LFT testing, and the government tells us that they're going to share with us models from some schools that they say are having better success at encouraging children to do these lateral flow tests. If we can get that, it will find some of the cases that will help drive down the total number of cases in school, as well as spreading the vaccination. So that would be a good thing to do. We just want to say that lots of our other advice is still on our website, including our COVID cases website. Thanks for watching. Thanks for being a member of the union. Together, we're getting our society through this, and we're keeping everyone that bit safer. Thanks very much.